I wanted to follow up on Mr. Westmoreland's question on interoperability. And one of the problems, as I'm sure you're aware, with health IT with regard to government entities is the VA and the DoD. Completely interoperable. When somebody completes their military service and goes to the VA receives a PDF file by email that's, you can't manipulate the data in any way. Somebody actually has to sit down at a computer and type in, it might be 30 years of medical data because they can't transition over. And one of the concerns I have with implementing health IT across the country is there are a lot of hospital systems, providers in this country that are doing the right thing now without government money, that are spending their own money and resources to get health IT off the ground. And I'm concerned about having a situation develop across the country that would be similar to what the DoD and the VA have, where you have systems that just can't communicate with each other. So I was wondering if you had some commentary on how we can prevent that from happening, because I don't want to be in a position where this money gets rolled out and we penalize the people who have already done this on their own by saying, well, sorry, but you're not compatible with the system that we want you to use.
Well, we don't want that to happen either, Congressman, and our view is that if we can provide the standards that allow interoperability and the models of working interoperable systems, which we have been doing through work that we're doing on something called the National Health Information Network, that if we can provide that, then providers will be motivated to take advantage of those standards and also of those mechanisms to achieve interoperability. There have been in the past some technical obstacles. We think those can be overcome, with that vendors could overcome them if purchasers demanded that they provide the capability. There hasn't been an incentive of the kind that we now will have under Medicare and Medicaid for individual physicians or institutions to demand that interoperability be a feature of the electronic health records that they purchased. Now, some of those vendors will be able to retrofit or add on an interoperability capability. Some may not. And in the latter case, it may be necessary for some providers to seek an alternative vendor. But they will have funding from Medicare and Medicaid to help them to do that.
How far away do you think we are, and how realistic is it that in the near future, my district is in Pittsburgh, Pennsylvania area, that someone from my district on private insurance will be able to travel to Portland, Oregon, show up at the hospital and have their records pulled up? And how far away in the future is that?
Well, I wish I had a crystal ball to answer that question precisely, and I don't. It's our goal to develop that kind of interoperable health system as soon as we possibly can. And I think that capability will be in existence within a matter of a few years for some types of providers, especially large institutions. But to say that it will be universally available in a particular number of years, I think would be hard to speculate about.
Thank you. And it's not much time, but I would be happy to yield my remaining minute or so to Mr. Westmoreland if he has another question.